5 health checkups to rethink after 70. What you need to know. As we age, our health priorities often shift, and we generally want to do everything we can to stay healthy and active. But there's something important that you might not hear from your doctor. Not all health checkups are beneficial as we get older. In fact, some routine tests could put you at greater risk for serious issues like surgery, stroke, or even cancer. Recent research shows that about 37% of medical tests for seniors can lead to unnecessary treatments and complications. Shockingly, a vast majority of people over 70 are unaware of this risk. One particular test, which I'll discuss shortly, is linked to causing around 5% of all cancer cases in the US. That's a number comparable to the risks of daily alcohol consumption. This isn't information you'd typically find in a doctor's office or see on a poster, but it's crucial for your health. Let's explore the 5 health checkups you might want to avoid after turning 70, along with the facts that could surprise you. Before we dive in, I'd love to hear where you're watching from and your thoughts on whether seniors are being tested too much. Feel free to share in the comments. I'll be responding with tailored tips just for you. And if you find this information helpful, please like this video and subscribe to our channel for more insights. Now, let's discuss the first test you might want to reconsider, the bone density scan. Number 5, bone density scan. At first glance, a bone density scan might seem harmless. It's a quick, painless procedure that helps you find out if your bones are at risk for fractures. But here's what you may not know. For those over 70, these scans often lead to more anxiety than actual benefit. The technical term for this scan is a DEXA scan, which primarily tests for osteoporosis. As we age, particularly for women, bone density typically decreases, but that's a natural part of growing older, much like getting gray hair or developing wrinkles. Unfortunately, many older adults receive alarming results that lead them to take medications designed to increase bone strength. While these drugs can seem beneficial, they also come with serious side effects, such as jawbone issues and irritation in the esophagus. Research shows that treating mild bone loss in seniors with medication doesn't significantly reduce fracture risks. A study from the American Geriatric Society observed over 1,200 women over 70 and discovered that these medications only cut fracture risk by 0.3% over 5 years. While that may seem like a decrease, it's far from life-changing and may instead lead to more health issues due to side effects from the medications. Let me share the story of Rose, a 76-year-old retired piano teacher. After her annual checkup, she was referred for a DEXA scan, and the results created unnecessary worry, prompting her to consider medications that she may not have needed at all. It's essential for you to be informed about what these tests entail, so you can make the best choices for your health. Your well-being and peace of mind matter, and understanding the implications of common tests can help you lead a healthier, longer life. Stay tuned as we reveal more about the other checkups to approach with caution. Imagine discovering that a simple scan could change how you think about your health. Many of us are understandably worried about things like bone health and memory loss as we age. However, it's important to focus on lifestyle choices that can truly make a difference instead of getting caught up in unexpected diagnoses from routine tests. Take, for example, a woman who was active, walking every day, and had never fallen. When she had a scan, it showed that she had osteopenia, which means her bone density was slightly lower than normal, but not in the osteoporosis range. Her doctor promptly put her on medication. A few months later, however, she developed unpleasant side effects like severe reflux and jaw pain, and she stopped playing the piano, an activity she loved. When we saw her, we decided it was time for a change. We took her off the medication and created a plan that included vitamin D supplements, weight-bearing exercises with resistance bands, and a diet rich in calcium from foods like sardines and leafy greens. The result? A year later, she was back to performing, stronger and more balanced, without any fractures. This highlights an important point for those over 70. If you're not experiencing falls or fractures, focusing on lifestyle changes like strength training, balance exercises, and proper nutrition is often the much better path. Research shows these methods can lower the risk of fractures by over 20%. So don't let a number on a scan dictate your treatment. You have power over your health through the choices you make every day. Now let's talk about something else that can cause anxiety: memory loss. When seniors notice their memory slipping a bit, the natural reaction is often fear of dementia or Alzheimer's. To address this, doctors may order a brain MRI. However, the truth is that these scans rarely provide the clarity patients are hoping for. Most MRI results in people over 70 simply show normal aging changes. But those results can lead to worry, more tests, and even unnecessary surgeries that might not help. For example, a 74-year-old man named George was concerned about some forgetfulness and was sent for an MRI, which showed typical age-related changes. He panicked and made drastic lifestyle changes, convinced he had dementia. But when we conducted a standard cognitive test, he scored within the normal range. We reassured him that his MRI findings were just part of normal aging and helped him focus on healthy habits like proper sleep, staying hydrated, and keeping his brain engaged with games. Within just 3 months, his memory improved. So remember, unless you experience significant neurological symptoms like seizures or a sudden shift in personality, an MRI for mild memory loss is often unnecessary. Instead, prioritize healthy lifestyle choices that support your overall well-being, and you'll likely see improvements that truly matter. You have the ability to take charge of your health. Taking charge of your health as you age is one of the best gifts you can give yourself. Knowledge is power, and understanding your options can lead to better health outcomes and increased longevity. Let's explore some common tests and the best approaches for seniors. To start, it's helpful to consider a cognitive screening test if you're worried about memory or thinking skills. This is a straightforward paper-based assessment that evaluates your memory, attention, and problem-solving abilities. It's cost-effective and can provide peace of mind without causing unnecessary worry. Now, let's talk about the cardiac stress test. It's the third on our list for good reason. This test is often given to seniors who feel fatigued or experience chest tightness. During the test, you may walk on a treadmill or take medication to simulate exercise while doctors monitor your heart. The goal is to identify any blocked arteries. However, if you're over 70 without clear signs of heart disease, this test might do more harm than good. The reality is that the test can produce many false alarms. Research shows that in adults over 70, up to 40% of stress tests can suggest heart issues when there aren't any. This can lead to unnecessary follow-up tests like angiograms and even procedures such as stent placements or bypass surgeries, not to mention the risks of complications from these invasive procedures. For example, let's consider the story of Raymond, a 75-year-old retired postman. He was active and enjoyed daily walks, but mentioned feeling tired on steep hills during a routine checkup. His doctor advised a stress test, which didn't clearly indicate a problem, leading to more invasive testing. Unfortunately, Raymond had an adverse reaction to the contrast dye used during an additional procedure and ended up suffering kidney complications. His fatigue remained unchanged, not due to a heart issue, but simply because he needed better hydration and regular rest between meals. If you're over 70 and not experiencing typical heart symptoms, like chest pain during mild activity, shortness of breath, or significant energy drops, a stress test might not be in your best interest. Instead, consider a resting EKG, which checks your heart's rhythm without stressing your body, or a coronary calcium scan, a low-radiation imaging test that assesses the buildup of plaque in your arteries. These options are safer and far less likely to lead to unnecessary procedures. Now, let's touch on the second item on our list, colonoscopy. You might not expect this one, but as you age, particularly after 70, colonoscopies may not be the best choice unless there are clear symptoms to address. The risks involved with the procedure increase as we get older, and for those over 75, it's almost never recommended. This is where being informed can make all the difference in your health journey. In summary, being proactive about your health with tailored and thoughtful testing can improve your quality of life later on. Always discuss your concerns and options with your healthcare provider and take a step towards a healthier future. Your health matters. Rethink routine screenings for a longer, healthier life. When it comes to your health, knowledge can be truly transformative. Let's discuss some common screening procedures that might not be serving you as well as you think, especially if you're over 70. Firstly, let's talk about colonoscopies. Many people believe these screenings are essential, but the reality is much more complicated. The preparation for a colonoscopy can be tough, involving strong laxatives that may lead to dehydration or dizziness. In older adults, the sedation used during the procedure brings its own set of risks, potentially affecting brain function. Most startling is the fact that complications can arise during the procedure itself, such as bleeding or heart rhythm issues. A large study from 2019 looked at over 1.3 million Medicare patients aged 70 and up, revealing a concerning statistic. For every 1,000 colonoscopies performed on patients over 75, only 2 lives were saved, while more than 20 patients faced serious complications. This paints a daunting picture, a 10-to-1 risk-to-benefit ratio. Even when polyps or growths are found, many are small and develop slowly. In older adults, sometimes it might be safer to leave them alone rather than remove them. Take Dana, for instance, a healthy 73-year-old grandmother who was encouraged by her new doctor to have a screening colonoscopy. Despite being symptom-free and having had 2 previous clean colonoscopies, she agreed to the procedure. Unfortunately, it led to serious complications, including a bowel perforation that resulted in a long hospital stay and ongoing health issues. The U.S. Preventive Services Task Force now advises that routine colon cancer screening can stop at age 75 for most individuals. For those in good health, a stool test like the FIT test, which you can do at home and requires no preparation or sedation, might be a better choice. It's less invasive and still effective at catching serious issues. Always discuss your options with your doctor, as getting caught in the cycle of invasive procedures can be challenging to navigate. Now, let's shift gears to another frequently discussed procedure, full-body CT scans. Often marketed as a preventive measure, these scans expose you to significant radiation, equivalent to about 500 chest X-rays, and pose a high risk of unnecessary follow-ups and invasive procedures. Disturbingly, there is no solid evidence that these scans save lives in patients who don't have symptoms. A recent study found that increased use of CT scans may now be a contributing factor to about 5% of all cancers in the United States, a risk that rivals known carcinogens like alcohol. Some nodules or cysts picked up on these scans are harmless and simply part of the aging process. But once they're detected, the cycle of additional scans and biopsies often leads to unnecessary anxiety and procedures. Consider Marcus, an active 80-year-old who taught martial arts. He took care of his health and stayed active, yet even he faced the pressure of routine screenings that might have led to unnecessary interventions. In conclusion, it's vital to assess the risks and benefits of routine screenings as you age. Always consult with your healthcare provider to find the best approach tailored to your personal health needs. Educating yourself is the first step towards empowering your health and ensuring a longer, more fulfilling life. Imagine feeling completely healthy, only to find yourself in a whirlwind of hospital visits and tests over a tiny finding during a checkup. This happened to a man who thought he was doing everything right by participating in a thorough health screening. A small nodule was discovered in his lung, which led to a series of follow-up procedures, including a needle biopsy that accidentally caused a lung collapse. Although the nodule turned out to be harmless, he faced hospitalization and a 2-month recovery, complications that could have been avoided. This experience sheds light on important advice from health experts. Full-body scans should not be used as routine screening for healthy adults. According to the American College of Radiology, these scans often yield no true benefits and can lead to unnecessary harm and anxiety. If you're experiencing symptoms like sudden weight loss, coughing up blood, or other unusual changes, then targeted imaging can be beneficial. Think of it this way: scanning your entire body without any specific symptoms is a bit like using a metal detector in a field hoping to find treasure. There's a chance you might find something, but the risks involved can sometimes outweigh the benefits. A more thoughtful approach is to stay in tune with your body. If you feel good, focus on regular checkups with your primary doctor and only pursue tests that your doctor clearly recommends. Your health and peace of mind are far too precious to gamble on unnecessary screenings driven by fear. So, let's simplify things. Here are 5 checkups that may seem helpful but could potentially cause more harm than good, especially for those over 70. While modern medicine offers incredible advancements, sometimes less is truly more. Always consider, what happens next? If a test reveals something, is the follow-up clear and safe? If the risks seem to outweigh any potential rewards, it might be worth holding off. Real prevention starts with your lifestyle choices. Stay active, eat nutritious foods, get quality sleep, and choose your health checks wisely. Now we want to hear from you. Have you or a loved one ever faced complications from a medical test or treatment that was, in hindsight, unnecessary? What did you go through? Please share your stories and thoughts in the comments below. Your experiences could help others make better choices about their health. Thank you for watching.